Hello, this is Mark Lieberman, the host of the radio show The World According to Mark, broadcast through WPVM FM in Asheville, North Carolina, 103.7 on your dial, and streaming on WPVMFM.org. Today we have an interesting guest. I know I say that a lot, but I try to only choose interesting guests. And her name is Geraldine Novy. Let me first say thank you, Geraldine, for being on the show.
Oh, you're welcome.
And Geraldine Novy is a multi-talented individual. We're going to talk primarily today about her work as the creator of a company called Pinwheel, that's one word, Pinwheel Wellness, LLC. And we're going to find out, you can tell us why you called it Pinwheel, but she's going to tell us what that organization does and what she does and a little bit about the history of it. So why don't we start? Geraldine, tell us a little bit about Pinwheel, how you started it, what you were doing prior to that, and how it operates today.
Sure. And thank you for inviting me to speak about my business that I'm very passionate about. I was first professionally an industrial designer. I went to Kent State and I had a passion for just being creative. So at Kent State, I just learned how everything works together and how things work. I was an international lighting designer, which kind of got me in trouble 22 years later because I ended up lead toxic from this profession from constant travel to China. This became known to me after I went into a second profession, being a nurse, because the housing market had fallen. I worked in Naples, Florida, and I needed to make sure I had a good profession. So I didn't want to wait around for the housing market to come back up. I had a business down there as an artist and a designer. So first year as a nurse in Naples, Florida, I realized that my digestion was slowing down, that my hair was falling out. I had atrophy, which means your muscles aren't strong and they're not holding their form. So I was fortunate to know Dr. David Perlmutter, who then did a 24-hour urine collection on heavy metals to see possibly what the problem could be, because I shared with him that I had been back and forth to China. So he suspected heavy metal in my body. Sure enough, I did have heavy metals. I was off the chart for lead. So cognitive issues also, brain fog. Long story short, he chelated me and then made me aware of food as medicine. Dr. David Perlmutter is a neurologist, a very well-known writer, on the New York bestseller several times. His first book was Grain Brain. Rainmaker's another one. He's got several others that have followed suit. So long story short, now I'm a nurse. So more interested in how food put my body back together to the point of my balance coming around within 18 months, 2 years later, my brain fog gone. My balance I valued because I was a figure skater. I've been an athlete my whole life, never did drugs, and wanted to continue with just some of the joys, and ice skating was one of them. So I went back out on the ice after about 18 months, 2 years, and I was able to spin again and jump like I remember doing before. So he, with his chelation, taking the lead out of my bones and soft tissue, and me replenishing my body with the right nutrients, getting my microbiome, that's your gut flora, back in order for optimal absorption, making sure I drank water, getting rest 8 to 9 hours a night so absorption could take place without disruption. All of this contributed to me then competing in Tampa, Florida with the adult women's synchronized skating team. So I got to do more of my joy. I think I competed with them for 7 years, from Las Vegas to New York City. So it was rather exciting. My health is good today. And my passion is to help others regain their joy and their health so that they can have a better well-being.
Well, let me let Geraldine take a pause for a second. There's a couple things that you said very early on, so I'm going to roll it back a little bit. So you were an industrial design person, having completed your degree and gotten your degree from Kent State. And then you went to work in that field for a company, presumably, that does lighting. And you traveled, as you say, back and forth from the United States to China, and meaning in effect, you spent a fair amount of time in China, and you noticed some things going on that didn't seem right to you.
Correct.
And you associated that with possibly something that you were doing or breathing or drinking or whatever. So that's a scary proposition. Now, in today's world, we're not on the friendliest of terms with China, but there's lots and lots of people who do business with China. There's lots of companies that in the United States that have plants over there, and we just have a lot of involvement with that country, notwithstanding political differences in terms of their regime and ours. So what is the source of, or did you ever find out, or was there ever any, work done to figure out what was the source of this? I guess the right phrase is lead poisoning that you acquired over a period of years. And is it potentially the case that that problem still persists in China? And so not only its native population, but people like you who were, traveling there could still be exposing themselves to that.
Yes, good question. So I was a product designer. Not only did I design fixtures like your dining room chandelier, for example, but the finishes that also out for the fixtures, whether it was a gunmetal silver or a polished brass or a aged bronze. Those typically are chemically plated, but at the time there were painted finishes, known, I guess, as faux finishes. So I created probably 15 different finishes for our company as an artist. And so I oversaw the application of the product, whether it was 500, 1,000, whatever the fixture demand was, to reproduce those finishes correctly. And I worked with quality control and the assembly people in China. So they perfected the company's identity of that finish, because it was very competitive. And we had other companies that would try to mirror our finishes that sold well, very well. And so I was hands-on, breathing in the lead paint and handling it. So because I'm the one that had to check off that the assembly team of wonderful Asian workers, they were very responsive, learned very well, but they didn't have the ventilation in the factories. They didn't have the gloves to wear or the safety goggles. So this is the late 90s that this all occurred. I was back and forth for a period of 6 years. And then, like I said, other issues arose. I had my passport taken by Chinese officials because I was a woman. Back then, they didn't have the same respect they have for women today. So I got a little intimidated about going there so much. And I left my job and my profession and moved to Naples, Florida, where there was a booming housing industry, and opened my own business.
All right. So before we leave that topic, because I know there's plenty of other things that we planned to talk about, did that information about the toxicity and what you derived as a result of being in a plant that was, as you say, not sufficiently ventilated? I don't know whether you can sufficiently ventilate something, but apparently it can be breathed in through the air. It can also be presumably through the skin, which would explain the gloves and the goggles and so on and so forth. Did any of that ever get back to the company so that they could then say, hey, this is a problem and we need to change the way we do business, or do something, or was that just, is that just the way it is today?
Well, that was China, and because their legal system is nothing like ours, in America, there's OSHA and there's ventilation, because we did a lot of these finishes also here at the plant. So the company was not really the problem. It was a third world country that just hadn't progressed far enough. Part of the reason everybody went there is they didn't have to deal with
Red tape.
yeah, exactly.
Right.
So I just happened to be in that situation, showing them how to make our product.
All right. So again, very last question on this is, I hear what you're saying about they're a third world country. One way of looking at it, they're third world in some respects. Some people say they're eating our lunch in terms of economics and technology and the like. And you mentioned OSHA. This country is in a period of time in which people are challenging the authority of OSHA. We saw it come up in connection with COVID, but the regulatory world is potentially changing, and a lot of the legislation and regulations that have been on the books is being challenged, or in some cases reversed. So do you think people in this country who are engaged in various kinds of activities could also be exposed to the same hazards that you were in China, if you know?
I'm more concerned about the chemicals and additives and preservatives in food in this country from our economical driven economy with the food industry. There's only 4 things that you will pass away from. One is stress. One is eating too much or not eating enough. The other one is exercise, not exercising enough or too much. And the 4th one is basically your food, nutrition. Did I mention that? Food,
You did, yes.
stress, toxicity. I'm sorry. I meant the fourth one would be toxicity. How is your body? How's your body doing if you did work in industry, or you're eating maybe a lot of cereal in the morning? And cereals in this country, many of them are coated almost like with a sugar that is harmful for the body's absorption. So I'm more concerned about people becoming aware of processed foods, because their optimal absorption then isn't at its peak to take in the nutrients.
Okay, so we're going to get into that. For those who are just tuning in, we're listening to Geraldine Novy, who is the creator of Pinwheel Wellness LLC. The word wellness is, gives it away as to what that organization does. We haven't gotten into it in depth. We're talking about how you got into it and your motivation. You did mention, in terms of your own personal health situation, that you had these toxic heavy metals, as you call them. Lead, I guess, is one heavy metal, and that the process for making you recover or become well as a result of that required something called chelation. And a lot of people may know what that is, but I'm guessing some people don't know what that is. So what is chelation, and what did you actually have to undergo to get those heavy metals out of your system?
So chelation is a way to remove the heavy metals, but there was evidence there from a 24-hour urine collection of heavy metals in my urine. So that was circulating within my body, in my connective tissue, in my bones. So that's why the remedy was chelation. And it's a form of chemotherapy. In a way, it just lifts the heavy metal from the connective tissue and the bone for whatever amount of time the doctor wanted it to be. I believe mine was 3 months. It was a pill form with this Dr. Perlmutter. And at the end, he had given me a shot of glutathione, which supports rebuilding the powerhouse cell which is the mitochondria. So that is the energy cell, which is important for us, the ATP. that generates the cell's recovery. So I share that with you only because I worked closely with that was very reputable, Dr. Perlmutter. And your doctor would be the one, a functional medicine physician or an integrative medicine that would order this test. I also can intervene with your physician if I think something needs to be done, if I am health coaching an individual, and we're focusing on their past, where they worked, were they a painter, did they do of glass, stained glass, were they in an industry where chemicals were? If I would have a hunch that that could be affecting their health, then I would recommend it and refer them to a doctor.
Okay. Now, again, chelation and Dr. Perlmutter, and you mentioned integrative medicine. I'm guessing that there are a lot of doctors who don't characterize their specialty as integrative or what they are. They're just, regular doctors, internists and orthopedists and so on and so forth, who may or may not believe or use the chelation technique as a way to draw off the heavy metals. And so it's not every doctor that presumably would respond in the same way that your doctor did. Do you have a comment regarding that?
Well, that's where I would work closely with my client on helping them locate a physician that would be receptive to doing and consistently would do that kind of test if I felt that was needed after assessing them and understanding their timeline, their life timeline, as Dr. Perlmutter did with me. It's important to know I was a first-year nurse when this happened. So I already had, like industrial design, I understand how to put a fixture together, from the little hex nuts all the way down to getting it illuminated with the slip-on candle sleeves. So now I know how my body functions. So when I did go to a primary care physician, my insurance covered, and they just wanted to put me on Protonix and antacid, I knew there was something more going on because I was a first-year nurse. So that if I wouldn't have become a nurse, I'm not so sure I would have ever suspected something more needed to be tested. So I was fortunate in that regard. So now that I know what I know and how the body functions.
You just cut off. Let me see if we get. So we got had a little technical glitch there. We're back on, and you were talking, Geraldine, about toxicity and having to do with chemicals. We talked about heavy metals. It could be other things as well. So why don't you continue on with that?
Yeah. So my focus is empowering people to manage themselves, self-care, because our insurance really covers us with our primary care physician. Some of our insurance may cover us for an alternative physician, an integrative healthcare provider, or a functional medicine physician. But to find that in your area, it's someone you would Google, functional medicine physician, your zip code, integrative health physician, to help you locate someone if you were interested to know, and if you worked in a heavy metals environment. So I just wanted to put that out there, but basically talking about inflammation, because when the body's inflamed, whether it's from chemicals from working in a factory, or like I said, the paint, or food, because many of our foods in this country are really created for shelf life. So, and enhanced color-wise. For example, many of the nice, beautiful cuts of salmon you see in the grocery store have red dye in them. Red dye is not nutritious for the human body at all, but it looks attractive for a purchase. And that way the store can move its fish. because they don't want to have day-old fish or 3-day-old fish. So these kind of awarenesses and questions you may want to ask in your poultry and fish area in your grocery store. Is there dye in there? So that's just one example. If people are cereal eaters and you turn the side of the box and you read all the ingredients, many of those ingredients are inflammatory to the body. So I work with people to understand that, and we kind of sift through, like, what is it you really like about this cereal? Like many of my female clients like honey bunches of oats, and I really hate to mention a food product, but that's one that comes up quite a bit. They snack on it, they have it with their cereal, with milk in the morning. That definitely has additives and preservatives in it that aren't nutritionally dense for the body's absorption. So I'll ask my client, what do you like about this? Well, I like the crunch and the granola, and now there's almonds in it. And now they even have blueberries in it. Well, are the blueberries real, preserved in a cereal box that's on the shelf for anywhere from a day to maybe 3 months until bought? So I break that down with them, and we talk about maybe getting a glass jar and putting organic granola in it, buying just almonds, slivered, almonds in another jar, and buy either fresh or frozen blueberries for your freezer. Now you're in control. And what are we eating? Clean, whole food, not something packaged, bodies at risk for inflammation because of the preservatives or the additives. The blueberry, I'm not sure what that's really made of in there, but you can get forms of food to make it taste like a blueberry. Why not eat a real blueberry, which is like a #1 fruit to build your immune system?
Okay, so 2 things. First of all, before we leave the issue of the integrative medicine, and you were giving some helpful advice about how people can contact and find and then presumably interview an integrative medicine specialist. But you also mentioned the insurance issue, which is a factor, obviously, for people when they're choosing who their healthcare professional should be. Are you suggesting, or are you suggesting that people should consider using an integrative medicine person trained in, and I don't know where you get the additional training, as a substitute for their normal family medicine person or general practice physician or internal med person, that they should if they have a choice as to who should be generally in charge of their quote healthcare needs, they should make their first stop in an integrative medicine practitioner?
That's a great question. That's not what I'm really saying, because it's so important to have health care and then health and wellness. So if you can imagine 2 arrows, and on my website, which is designed to be educational, you'll find this double arrow chart that I'm speaking of, which is evidence-based research. On the left side is the healthcare, where signs, symptoms, medication, surgeries. Now pre-diabetic, maybe you're taking metformin. Now you're diabetic, you're taking insulin, high cholesterol. All of those would be in healthcare. So your primary care physician is very interested in making sure that you are functioning. And he can see your blood pressure, reading your labs, your A1C, your cholesterol, to know if you need to be put on a medication. So that's covered, that's our insurance. But on this side is health and wellness. So a person has a choice. Some people are comfortable taking their medication. I recommend that you look at that double arrow that's on my website to understand the most of what I'm speaking about.
Why don't you give the website while we're on it?
Oh, okay. It's Pinwheel pinwheelwellness.com. And I guess I can kind of flash this up.
Absolutely. Okay. So pinwheelwellness.com. If
Can you
people,
see that okay?
we can see it. Those on the listening to this on the radio cannot see it, but we just gave it to them. All right, go ahead.
Right. So my point of bringing this up is basically you need both. We want to stay in our home and live in health and wellness. We don't want to be on a track in healthcare, which is the hospital. Okay. Because if people aren't educated, because diabetes type 2 is reversible by understanding better food choices. Someone with high cholesterol, I work with on making better food choices, activity, decreasing stress in their life, increasing rest and joy so that the body can relax. So absorption is optimal when they start looking into better food choices, understanding what foods are inflammatory, because diabetes type 2, heart disease, asthma, fibromyalgia, migraines, I can go on and on. Mood swings are all related to inflammation. So when inflammation markers are up, guess where the immune system is? Down. You start to bring down the inflammation. Not only are you bringing your other diabetes, your blood sugar, your blood pressure, but you're also raising your immunity, which today, related to COVID-19, is so important because people that have a stronger immunity do so much better, even with or without the protective shield of the vaccine.
Okay, so let me just point out, and again, you certainly should comment on this. You have this double arrow, as you say, on your website, and you're illustrating in this discussion how, on the one hand, you have a doctor who follows a more orthodox line, whether she or he calls themselves a family medicine person or internal medicine person based upon their board certification. Those people are trained to diagnose and to then prescribe treatments, which might include medication, might include surgical intervention, so on and so forth. And the suggestion from what you're saying is those are people who are needed to address significant problems that are already there. They can be chronic, but they can also be traumatic. You know, you don't go see a nutritionist if you just broke your arm, as a sort of a bad example.
Correct.
And then you have the integrative medicine folk who are there to assist and help, and obviously with organizations like Pinwheel, to recommend things that a person can do on their own by making better choices in terms of food selection, exercise, sleep, less stress, and so on and so forth. But my sense of things, and I hope you can disagree or agree, is there is a place where those lines they cross. In other words, as you mentioned, if I went to a so-called regular doctor, and I said, you know, I've been taking these statins, you know, for high cholesterol, can I get off them? What would be the approach? My guess is he or she might say, well, you can eat less red meat, although that's increasingly not becoming such a well-accepted premise because your body manufactures cholesterol. But he or she might say, listen, it's working, you're doing fine. Yeah, of course, you can cut down on your red meat. You can have a Mediterranean diet, blah, blah, blah. But there are points at which I suspect that the integrative professional and the quote orthodox regular doctor are not going to be advocating the same thing. And that, I think, can be confusing and problematic for a person who needs to make choices in how to handle their life.
So first, let me explain, and I'll address that. I'm a registered nurse and a national board certified health and wellness coach. I'm also a functional medicine certified health coach. So I belong to the Institute for Functional Medicine. So I get to see the evidence-based food plans and work with those. I also work with the phytonutrient spectrum of foods. And we can talk about that a little bit later. But I work in the hospital 2 days a week. So that double arrow I'm talking about with healthcare on one side and your home and health and wellness on the other, that's where I try to keep my clients. That's where your traditional primary care physician would try to keep you, of course, also. And if your A1C is 7.2, he's going to recommend a medication. And I would, if you showed me your labs, I also would send you to talk to your doctor about that, because I would want you to be protected. But then if you were had interest of not continuing with that medication, that's where a health coach, which is what I do, would work with a physician. So as a board certified health coach, that's where I work with people to meet their optimal vision of health. And majority of what I work with them on is their plan, because everyone knows what they want to be healthy, but it's the behavioral change that is the biggest challenge. So a health coach works with positive psychology, addresses the values and vision of the client who wants to lower their dose, or maybe just wants more physical activity. Maybe they're not on a medication, but wants a health coach to support them with their daily activities. Or perhaps they're stressed, don't like their job, and they need to understand relaxation techniques, which so much of inflammation also is brought on from people not getting optimal amount of sleep and being stressed. So I work with people with just how to decompress, meditation, deep breathing exercises. So as a holistic nurse, which I do belong to the American Society of Holistic Nurses, that was my first step into health coaching. And then I saw how the health coaching also pulls in, what does the person value? What do they want? Because being in healthcare on the left side is on a track of medication, procedures, and we can relate possibly because we saw our parents on medications and how they didn't have a good quality of life. My father had heart disease. He was on medication. Unfortunately, I didn't know what I know today to have worked more closely with him with better food choices. Like, in other words, not eating the bag of potato chips, but maybe trying plantain chips, which is a more wholesome chip, because a plantain is really more nutritious than that potato chip, with the way that it's processed and the way that it's made. There's plantain chips today that are made in coconut oil, and it has 3 ingredients: sea salt, the plantain, and coconut oil. So there are other alternatives people can choose, so they don't have the inflammatory markers in their body high. And again, if the inflammation's down in the body, your immune system naturally goes up. So that's my focus. Again, when they took the lead out of me and the toxicity, and I started to realize what were better food choices to rebuild my body and my microbiome, then that became my focus, to the point of being athletic again all through my 50s to compete.
Okay. We're listening to Geraldine Novy, who I want to reintroduce. She's a specialist, if you don't mind me saying that, in holistic medicine, integrative medicine. She has her own health coach organization, company, Pinwheel Wellness LLC. Previously gave out the website if you want to visit, pinwheelwellness.com. And we're talking about, I guess we're talking about how people can take better care of themselves. But one thing, again, that sort of strikes me as important is how do people figure out a way to access this kind of coaching and help? Obviously, if people know about you and other health coaches, they can just call you up and make contact and fill out an application and visit, and you'll do an intake form and you'll find out a whole heck of a lot about them. Or they could have a doctor who's sufficiently accepting of the kind of work that you and others in your field do, who might be willing to say, I think you should see so-and-so because they can help you with a lot of other things that could contribute to your wellness. But what I'm struck about, again, sort of from my own experience as well, is, and I'm sure this is everybody's experience, you go to your physician when you either have a problem or when it's a checkup, or you had a problem and you want to make sure that the problem has resolved itself. And you fill out a bunch of paperwork, which I'm willing to say nobody ever reads. And you fill it out this over and over again. And even if the doctor is part of a healthcare system and they're related to this and that, you know, great that we've got HIPAA, but nobody gets that freaking information. I don't like to say freaking on the air, but they don't get that information. That's why they keep asking for it. But it seems to me that if people really are going to be able to plug into what you do, they've got a couple of choices. First, they can either do it themselves, and there's plenty of information on the internet, or they can see somebody like you on their own, or their doctor can recommend. But what would be great is that the whole port of entry into healthcare, however you access the healthcare system, somebody says, well, you're looking fine, except you could do better with this. Here's some medication, but I recommend that you start taking better care of all the other things in your life. What you eat, how much rest you get, level of stress. And people say, you know, reduce your stress. But then people say, well, how do I do that? Well, how could I possibly sleep 9.5 hours? I've got 3 jobs and, you know, 4 kids and so on and so forth. But if people would be matched up with giving the information and then having somebody like yourself who is responsible for assisting that person until that person gets it and can do a lot of the things by themselves, that would be great. But we don't have that kind of system in our healthcare. We're getting there. There are options, but we don't have a system. Would you agree?
No, there isn't a clear system there because most Americans will go where their insurance will cover them. And if they don't have insurance coverage, most people hesitate to pay for their well-being. But your body's function is no different than your car. You need your car to rely on to get you to the grocery store, to work, or whatever, to the gym. Your body is being put in that car. So what are your values? You will maybe shop around to get a good deal on your tires, but are you shopping around to find a good physician, you know, that meets your objectives? What is your vision of optimal health? Is it decreasing your meds? Is it greater activity in your life? So again, I mentioned this word once, I believe. Self-care is important. So
and that's a self-care for those listening is a divine responsibility. That's what you're saying. What do you mean by that?
What I mean by that is if I wanted a new car, I would take care of myself to go to a few different car lots and realize, well, I don't need a really big one. I don't need luxury. I'm looking at an electric car that would benefit me. That's all I hear talking about on the news. So I'm taking care of my interests. I have a value maybe for an electric car. And so my vision is me driving an electric car. So I do the research and I'm looking to get my needs met, to get that challenge met. So if people feel tired, that probably happened over time. And I'd be curious to know, what are your food choices? Are we doing fast food? Are we doing a lot of processed food, which is typically sold in the center of your grocery store? Are you looking at the anti-inflammatory foods? That's something I challenge everybody to Google. What are the anti-inflammatory foods? There's plenty of them and plenty of different ways to eat them.
Well, while we've got you on the air, why don't you give some examples of the kinds of inflammatory food that people keep eating, notwithstanding the fact that they probably know instinctively it's not the best thing to eat?
Well, typical America's breakfast, we'll just talk about breakfast, is cereal out of a box or Eggos or Pop-Tarts. So I encourage people to read the labels on those boxes. There's not much of dense nutritional value there. So bacon and eggs, bagel, a Krispy Kreme donut, there's a huge sugar load. There's a huge cholesterol load there. Sugars and salt are not our friend, especially if you're diagnosed with a high blood pressure. You definitely want to be mindful of your sodium, your salt intake. Sugar rots. Anybody that's a cancer survivor or may have cancer or know of a loved one, one of the first things the doctor will talk to them about is to be mindful of the sugar intake. So I give an example of a banana. A healthy banana for your smoothie or your cereal is a banana that's closer to green and yellow, not so much yellow where you're starting to see the dark brown, blackish bruising come about, because that is an indication of a lot of sugar. So you could say that's a rotten banana, but just imagine if you have more sugar in your body where your A1C and you're diabetic, or your A1C and your blood sugar is elevated to the point of being pre-diabetic or diabetic, that is, you're compromising your kidneys, your eyes, which are the smaller vessels in your body, not to mention your extremities, which many people get amputation of their toes, ankles, below or above the knee because of sugar rotting those areas. So I bring all this to your attention because there is a choice, but people aren't aware of the choice because here we manage it in healthcare with medication, as opposed to talking about keeping people on the side of that double arrow in health and wellness. And that's what a functional medicine physician can do. By the way, you can find also a functional medicine physician by Googling Institute for Functional Medicine. There is a link there where, you can identify where you live to plug it in. And I work connected with the doctors to take care of your well-being. My position there is a nurse understanding your body's function, the medication, and how to health coach somebody, supporting them with their optimal vision of health related to behavioral changes.
So let me talk about this a little bit more with you. Choices, people need to be aware of what choices are out there, and they need, and again, we talked about inflammation, we talked about stress. I would reckon to say that there's been enough information out there for any person who can, as they say, fog a mirror, to know that a diet that is consisting primarily of processed foods, overly sugar foods like cereals, particularly, Lucky Charms, or, you mentioned some, whatever, the food, the breakfast cereals of our youth, fried foods, that those aren't good for them. Right. But that doesn't mean that they're doing anything about it. You turn on the television, and after you get through about 3 pharmaceutical commercials on television and a couple of advertisements for insurance for protection for your car, you're going to find a fast food commercial, Taco Bell. I mean, not to pick on any particular restaurant, but you take a restaurant like Applebee's. Applebee's doesn't look like a traditional fast food restaurant, but the food it serves is probably every bit as inflammatory, high calorie, high sodium as buying something from Burger King or McDonald's, because I've seen their menus for a very brief time. Well, they now show the caloric content, and that's probably about it. I don't know if they show, but a lot of foods, even ones that you might say, oh, it's a salad. Yeah, it's a salad, but it's a salad where they use a very high calorie dressing. So you can make the choice to say, okay, I don't want the dressing. But people, and you go down, any major road, any major commercial road, and you'll see place after place with drive-through lines, and people are buying, chicken nuggets, all those things. And they've heard the story that you've told, and they know instinctively, yeah, that could possibly do better, but just this once, or I'm too busy to make food at home, or I have a lot of others. I have a lot of other things to do, so they're just not doing it. Then there's a degree of where, you might go to a restaurant, or you might buy something in the store. Suppose you don't buy, sugar pops or tops. You buy something that comes in a little bag, and it says, grain free. But then, as you indicated earlier, it might say added blueberries or whatever. You think you might be making a smart choice to buy it, but it might not be any better, or could conceivably be worse than buying, bran flakes in a box. So my sense is that no matter what you tell people, that unless they take responsibility for their health, they're not going to do the things that make them better. And as you said earlier, if their insurance company is not going to pay for this additional benefit, then they're not going to do it. They're not going to do it because it's too expensive. I don't know. Go ahead.
I'm not so sure it's too expensive. We have gym memberships. People do value activity. So I'm here to say that believe it or not, if you understood what better food choices, the exertion of constant activity at the gym could probably be decreased, because now you're not eating the inflammatory foods that would put the weight on, like of the white foods. I'm talking about the breads, the pizza. Sorry, I love pizza too, but I work with people. What pizza dough would you buy to make a better choice? So understanding, better purchases, reading ingredient labels, knowing what the white foods are, from the hot potato, which is 2/3 higher on the glycemic index than a cold potato, meaning potato salad. French fries are totally out. Sorry, America, but sweet potato fries are in 100%, a much better choice, and sweet potatoes all day long. But your idea of bread and pasta and rice, a substitute for rice would be quinoa. And if your custom is so where rice is a staple in your diet, I work with my clients to try half quinoa, very high in protein, and still do half the portion of your rice, mix them together. At least you've cut down some of the blood sugar. So I guess what I'm saying is awareness is key. And again, if you look at the health and wellness arrow that I'm referring to, the first step is awareness that there's a problem. We may be putting weight on as we get older. Now we're on a blood pressure med. Now we're pre-diabetic. So the foods that we're eating definitely contribute to this. And knowing which food contributes and knowing how to handle that to decrease your blood pressure or your blood sugar or your cholesterol, and then that would relate to the other inflammatory diseases. Maybe you don't have as much pain with the chronic diseases like rheumatoid arthritis, or your migraines are slowly not as bad as they were, or not as often. So Awareness is key. Then there's education and your personal growth. So again, I go back to saying self-care. You took care of yourself, or I did, to go look for a car on a lot. I want one that's electric and reputable, safety. So I shopped those values out for myself. I also value my health now that I was walking sick, being lead toxic, and knowing the difference. So what do you value? What would a person value? So once they can be clear with that, then the availability of working with a health coach that may direct them to talking to a functional medicine physician, having their primary care physicians important, but now they have a functional medicine care physician that's going to focus on their health and wellness, not just their medication, and managing them so they don't get more chronic disease or their inflammation goes up higher. But in the health and wellness area, my business is decreasing inflammation because I saw the difference of gaining my energy back, sleeping through the night, not being as stressed as I was with my professions, because I'm better, eating better, and the absorption from my microbiome, which is your garden of absorption, creating a good, strong absorption in your GI tract so that the body can replenish, the cells do replenish to maximize on your whole well-being. Once you know the difference of that, you just become an advocate for whoever you're working with and knowing where to direct them to get the help they need. But first, they need to be making the decision that they want to take care of themselves now. There's so much research. We don't have to follow the same track as our parents did 20 years ago. We have a choice now. Healthcare, health and wellness.
Okay, you had another chart, which I know people on the radio won't see, but why don't you pull that up and then tell us what that is for those who are listening.
Okay, so it's a phytonutrient spectrum of foods, and it's just a kind of a eat a rainbow.
Let's look at it again. Go ahead, keep it up.
It's basically, I work with the kids on this note also. I work with my patients in the hospital to understand what eating a rainbow means. Again, it's through the Institute of Functional Medicine. It's a supportive tool I use that will decrease inflammation, also known here for anti-cancer, cell protection, heart healthy, liver health, antibacterial, skin health. So there are benefits on here that totally relate to the color of the food that you would eat. And so creating smoothies with my clients, understanding better choices of cereal foods to give you what you want, as far as if it's anti-cancer, anti-inflammatory. So there are tools that the health coach works with. And like I said, I belong to the Institute of Functional Medicine. So I have privy to many evidence-based researches from even selecting what are the best supplements for the individual.
Okay, so let me, we just have about 5 minutes left. I want to sort of plug in again here as to how people can access not just Pinwheel, but people like you who are health coaches. Let's just say that somebody believes that they have the motivation. You have to have the motivation. And maybe you're motivated because you don't feel like you're feeling your best, or you're concerned because other people in your family are coming down with or developing chronic diseases. So they contact a health coach, and they might find you, they might find somebody else. When that happens, again, I'm assuming that the first step is you or some other health coach sits down and talks with them. And do you ask them to bring medical records, lab results on the first visit, or do you sit down and have an interview of them and find out what their motivation is, And then from then on, excuse me, what are the next steps? How many times do they need to see you? And just give some idea. You don't have to talk about your charges, but what is the relative cost associated with this?
So first of all, there are health coaches that are national board certified health coaches like myself. It was important to me as a registered nurse working in healthcare. And like I said, I work at the hospital 2 days a week and seeing pre-diabetic, diabetes, high cholesterol, heart disease, asthmatic patients, and knowing they have a choice, and then talking to them about how they could get toward living in health and wellness. So I am a nurse and a health coach. So that is a benefit, understanding what really is going on in the hospitals and how to help someone stay out of the hospital and stay closer to the health and wellness part of the arrow, living at home, not so many hospital visits or visits to see your doctor. So in saying that, I would ask them, number one, as I've mentioned before, what is your optimal vision of health? Is it decreasing medication? Is it greater energy? Losing weight? Losing weight typically and naturally happens, bring down the inflammation, the immune system goes up and your weight comes down, related to understanding, being aware of your food choices now and why is that important for your body? So I'll even go in and talk about the body's function as a nurse, understanding the function of why it's important to drink water. Sure, you like your other beverages, if it's coffee and tea, but water typically cleanses the body and so important for the function of the kidneys to clean your red blood cells. People don't know that. So I educate also about the function of the human body. So understanding how a health coach works, there's many different ways. As a nurse and a health coach, I offer 3 packages: gold, silver, and bronze. I also have an hourly rate on there. So if you get the gold package, I think it breaks down to maybe $60 an hour. Whereas if you just, and that's 3 months of my time, and I think 10 visits. So in sharing that with you, you may say, well, that's a lot. Well, behavioral change. We need a support system. If you're learning how to run track and compete in the hurdles, you're going to need a coach to teach you the form. And until the muscle memory of that form over the hurdles is really established, you're going to constantly need to be coached, and more information is shared, and you take small steps for change to see progression. And a lot of this then becomes neurogenesis, which means new brain change, new brain cells, and you're thinking differently. You see greater energy, you see progression. So it's small steps, because we didn't get this way in 3 months.
Okay.
Over
Well,
a length of period of time.
that's going to be the last word. Geraldine Novy has been my guest today, and we've talked to her about wellness. Pinwheelwellness.com. Learn more about it. But it's been a great session, and I want to thank you very much for being on the show today, Geraldine.
Thank you. My pleasure.
Take care. We'll see you again next time.
Okay, great.